All right, let's dive right in. Today, we're tackling a topic that honestly touches so many of our lives: anxiety. We're going to break down this really complex feeling, kind of chart a path from that inner storm to a sense of inner calm, and we'll be using insights from a top mental health resource to guide us. So let's get into it.
Yeah, this just nails it, doesn't it? I mean, it perfectly captures that completely exhausting feeling. Like you're just a passenger in your own mind. Your thoughts are just racing and racing on a loop, and your body, it's just doing its own thing, not listening to you at all. It's such a powerful and honestly a super relatable way to start this conversation.
Okay, so our first section is called the inner storm. And this is so important because we're going to start by really exploring why anxiety is so much more than just, overthinking. So let's look at some really specific and super common experiences. See if any of these resonate with you. Maybe it's that constant sense of worry or dread, or those racing thoughts that just will not let you sleep. Have you ever felt that awful tightness in your chest or heart palpitations? Or maybe you found yourself avoiding social situations or certain triggers. Or hey, maybe you've had a sudden panic attack out of nowhere. The source also mentions sleep or even digestive issues that are tied to worry. And here's the main takeaway, the most crucial point from our source. If any of this sounds even a little bit familiar, you are absolutely not alone in this.
And this leads us to maybe the most important message in this whole explainer. These experiences, they're signs of treatable conditions. They are not, and I really want to emphasize this, they are not character weaknesses. They're not personal flaws. Just letting that sink in, that's a huge mental shift, and it really is the very first step toward healing.
All right, on to our next section, putting a name to it. See, once we accept that anxiety is a real, legitimate condition, the next step is actually defining it. Because understanding the specific type you might be dealing with, well, that can be incredibly empowering. It really helps clarify the path forward. So it turns out anxiety isn't just one single thing. It actually comes in several different forms. For instance, you've got generalized anxiety disorder, or GAD, and that's that chronic, excessive worry about just everyday stuff. Then there's panic disorder, which is all about those sudden, repeated panic attacks. Social anxiety disorder, that's an intense fear of being judged in social or performance situations. We also have health anxiety, which is a persistent fear that you have a serious illness even when doctors say you're fine. And of course, phobias. Those are extreme fears tied to very specific things or situations. And a really important one, anxiety often shows up alongside things like depression or ADHD, and that mix requires some real expert care.
Okay, so we've acknowledged the storm inside, and we've put a name to what it might be. Now, let's talk about the most hopeful part of this entire explainer, the actual path to regaining control. This next section is all about the structured, practical journey toward treatment. What I love is that our source really breaks the whole treatment process down into this clear, totally manageable path. It's not some vague, scary journey. It all starts with step 1, a really in-depth assessment. This is just a confidential talk to explore your symptoms, your history, your triggers. From there, you move to step 2, creating a personalized plan. And this is key because there's no one-size-fits-all solution here. Finally, step 3 is all about regular monitoring, just consistent follow-ups to tweak the treatment as needed and support your progress along the way.
All right, now let's tackle some of the biggest questions and concerns people have, the things that often stop them from seeking help. We're going to do a little quick-fire Q&A with all the answers coming straight from our source material.
Okay, first question, and it's a big one a lot of people have. Can anxiety actually cause physical symptoms, like chest pain?
And the answer is a big, definitive yes. Things like heart palpitations, dizziness, muscle tension, those are super common physical responses. It's basically your body's fight or flight system kicking into high gear. It's just a really powerful reminder of that deep mind-body connection.
Next up, a question about treatment. Is it actually possible to handle anxiety without using medication? Absolutely. 100%. The source makes it clear that tons of people get huge benefits from things like therapy, mindfulness, and just making some lifestyle changes. Think of medication as just one tool in the toolbox. It's recommended, but only when it's really necessary. And for our last question in this rapid-fire round, and this is a really important one, is it common for anxiety and depression to be related?
Yes, they often do go hand in hand. I mean, think about it. Living in a state of constant anxiety is just emotionally exhausting. It can completely drain you and lead to depression. And that's exactly why an integrated treatment plan that addresses both is so, so important.
So, as we start to wrap this up, I want to take a second and just focus on why this all matters. Because this whole conversation, it's about more than just managing symptoms. It's really about shifting our entire perspective toward healing.
And I want to leave you with one final, really powerful quote from our source. It's simply this: "You don't have to live in survival mode." And that just captures the goal perfectly, doesn't it? Getting help isn't about just surviving, just getting through another day. It's about reclaiming your ability to actually live, to thrive.
The source we've been looking at talks a lot about regaining control. So I want to leave you with a question, just something for you to reflect on. What does that phrase, regaining control, what does that actually mean to you? Think about that for a bit. Thanks so much for joining me.